Well, in this week's Wellness Wednesday, we are discussing MASH, and no, not the TV show, but the MASH. And joining us now is Dr. Robert Smith with Digestive Health Specialist in Tupelo to tell us all about it. How are you, Dr. Smith?
Doing just fine, Sonia. How are you?
I am doing great. So MASH, what is MASH?
Okay, so MASH is actually an acronym. It stands for Metabolic Dysfunction Associated Steatotic Hepatitis. That's a really, really complicated way of saying that the liver basically accumulates fat over the course of time. That fat begins to cause inflammation in the liver. And if it's not dealt with, either with lifestyle intervention, medications in some cases, this can actually lead to the development of scar tissue in the liver. Scar tissue is not something that we want in the liver because if it accumulates in too high a degree, you can get dysfunction of the liver.
Now, when it comes to the diseases that can lead to MASH, what are they?
The biggest risk factor for MASH is actually going to be obesity, but there's several things that kind of go along with that. So things like high blood pressure, high cholesterol, type 2 diabetes, in addition to obesity, certainly are diseases that are associated with MASH. And over the course of time, these are also risk factors for heart disease. And so they share a lot of risk factors, and that's one of the reasons that, in addition to the dysfunction of the liver, we get concerned about MASH.
Now, when you look at the diseases, just going back to that real quick, high blood pressure, can it also be coupled with like cholesterol and diabetes?
Absolutely.
Or is it just one disease within itself can cause MASH?
So it's not necessarily one disease in itself that's causing MASH. It's a constellation of a lot of different diseases. So these diseases tend to run together. And so in people who have MASH, we'll frequently see things like high blood pressure and high cholesterol and diabetes.
Oh, okay. And when it comes to treating MASH, what can we do?
Well, the first step that we tend to recommend in the treatment of MASH is going to be some sort of lifestyle change. And that's usually going to be a combination of increasing physical activity and also decreasing caloric intake. And there's a lot of ways to do that.
And then what about medical or surgical weight loss?
So several options there. As far as surgery goes, the most common procedure performed is what's called the gastric sleeve, which is basically a restriction of the stomach. And as far as medications go, the new kid on the block is sort of the GLP-1 medications. Those work pretty well.
And when it comes to treatment of MASH, is there any way you can actually reverse the fatty liver?
I'm glad you asked that. There is. So there's a new medication on the market called resmetirom. And this is a medication that works directly on the liver that actually lowers the amount of fat in the liver and decreases the amount of inflammation concurrently. And over the course of time, actually in clinical trials, we can see that there is some reversal in scar tissue in a good number of patients. So it's a really effective drug.
I was going to say, that sounds like a really great information there too.
Right.
Well, thank you so much, Dr. Smith, for
Of
joining
course.
us this afternoon.